Thank you, and welcome back. This is Gerald Smith, and welcome back to Center Radio, the COVID-19 Indiana County. This is episode 3. I'm happy to have joining us today Representative Jim Struzzi from, I think he's dialing in from Harrisburg. Are you in Harrisburg, sir?
I'm actually in the district office in Indiana.
Oh, you're in Indiana. You're right around
Yes.
the corner.
Yep.
If we weren't socially distancing, I could go and shake your hand right now.
You
but
could.
It's not going to happen today. Well, thank you for being here. How are you doing?
Oh, we're very busy. Since this started, particularly since the governor shut down all non-life sustaining businesses, our offices have been inundated with constituents, business owners trying to understand, what this means to us here locally. As Senator, go ahead.
Sure. Well, I was going to say, if we can get right to it, I think we heard from Senator Casey, there's a lot of legislation happening at the federal level. And I know also at the state level, there's been some bills in terms of helping stimulus. And I know, obviously, at the state level, the unemployment insurance plays a major factor. Could you talk to us a little bit about how you see the federal stimulus bill affecting our region? And also, if there's things at the state level that you can talk to us a little bit about that our audience should be aware of.
Well, absolutely. I think that the federal stimulus bill is key for helping our families survive, first of all, for helping our small businesses survive, and obviously providing the personal protective equipment that all of our healthcare providers need. I think it's vitally important that at both the state and federal level, we provide the resources that are necessary to survive this crisis. So at a state level, I was in Harrisburg last week. We passed a number of bills to help ease some of the burdens on local businesses, eliminate some red tape for healthcare providers. There's a lot of information out there right now. From the local level, I'm continuing to staff our offices. Although our doors are locked right now, we always have someone in the office here to answer questions, concerns, emails. We've been trying to provide a lot of information on Facebook and on my website. One of the key things we provided last week in Harrisburg through the number of bills that we passed, one was to provide $50 million in funding for healthcare providers. We also eliminated some of the restrictions on unemployment compensation so people don't have to go through the waiting period. They don't have to continue to search for jobs right now, but they can apply for those benefits. We also, of course, as many people know, we moved the primary election from April to June 2nd. And then we also, in alignment with the federal tax changes, moved our payment dates to July for the tax return. So those are some of the things that we're starting to do now. We're continuing the conversation. Obviously, there's a lot of work happening right now with new bills. We'll be returning to Harrisburg next week. We're looking at ways to assist our volunteer firefighters. One of the biggest concerns, as I mentioned earlier, is a lot of our businesses are trying to understand why they can't be open and other businesses can be open. I'm telling you that has been the bulk of the questions we've been receiving in our office, and our phones have really not stopped ringing since these forced closures came out. I think it's very important, Gerald, and to everyone listening, that we take this very, very seriously. I know there's a level of anxiety across our society, in our community right now, and rightly so. This is a very serious virus that we have to take seriously. But I also think there has to be a balance in helping people sustain, their jobs, sustain their livelihood, provide for their families. So I think the federal stimulus is going to be great in helping us, provide for our families, make sure that people have what they need to survive. But we need to have a balance of what is life sustaining and what is not. Can businesses stay open and still align with the CDC guidelines? And that's what we're trying to decipher right now, working with the governor's office. There's no partisan issues in this discussion. Everybody has to work together right now to provide for our families and our communities. And that's what my office has been trying to do. That's why, I'm working with my colleagues around the state to try and craft legislation to get us through this. And that's our only and our primary focus right now.
Great. I appreciate that. So if I could ask a little bit more about the businesses that are looking to stay open. I know there's a waiver process that if businesses are initially assumed to be non-life sustaining, that they can apply for a waiver, and that waiver goes through, I guess, the governor's office. Could you tell us a little bit about how many of those waivers that you've seen within I guess, your district, mostly Indiana County, and secondly, for businesses that are staying open, is personal protective equipment being universally available for businesses that are, I mean, obviously hospitals and healthcare industry for sure. I'm thinking about other places, such as I think coal mines are open. And so if folks want personal protective equipment and these other industries that don't usually have them, is that available?
Well, I think obviously, as you said, the primary focus right now is for those on the front lines, the medical workers, emergency responders. I know that there has been discussion about trying to make more available to those life-sustaining businesses that have to stay open, yet have to have, employees in close proximity. So I think as those requests come in, we're trying to make those available. And obviously the $50 million that we provided through state funding will help, as well as the federal stimulus right now. I really think that it's behooving of all of us to adhere to the CDC requirements, maintain those safe distances. And I think that's the confusing part for a lot of these businesses, or maybe single proprietor businesses that, one person in an office or one person maybe doing sales. And a lot of the waivers that came in were pertaining to that. Auto dealers, can we do online sales? Can we do appointment only sales? And when you have perhaps a standard for one business that would seem to apply to another business, that's where a lot of the confusion has come in. I know that there were in excess of over 10,000 waiver requests, and I still think they're processing some of those. These are being channeled through the Department of Community and Economic Development, and that's where a lot of people can learn more information about those. And we're still hearing from businesses who submitted waivers, more than a week ago and haven't heard back yet. So we're trying to navigate those waters along with everyone else, providing the information. And I think one of the key things for everyone to get through this is communication. That's why, I'm continuing to have my offices open, or answering the phones, answering emails, and we're trying to put as much information as we can out there on our website and our Facebook page. And I think that's really fundamental, because there are so many questions. And with the stimulus package coming out, even more questions have arisen. So I'm thankful to hear Senator Casey give some of those explanations. And I know that the news media, local media, and all of us have been trying to do what we can. So it's so vitally important, I think, that we continue the communication channels and that we make sure everyone has the information and the resources they need to survive this crisis.
Great. Can I ask you a little bit about, in terms of resources, there's been a lot of questions about testing within Indiana County, and how much testing has happened, are tests available? We had an investigative journalist on the last program and mentioned that there's a lot of rumors going around about within Indiana County, within your district, about who's getting tested and who's not. And part of that is, I think there's a lack of actual information about what is the process, how, are there tests available in Indiana County? Can your office shed any light on, what is the status of testing in Indiana County?
Well, sure. I first of all, as Shireen said, we only have 6 confirmed cases right now. I have not heard of any shortage of testing, although I do think they're doing the tests, as needed. And the Department of Health is encouraging people that if you have symptoms, but they're mild, self-quarantine. You don't need to come to the hospital if your symptoms are mild, stay home. And that was the correspondence I had with the Department of Health late last week when we had our first case come up here in Indiana County. And I had some very real concerns, very serious concerns, with the fact that it took more than a week to get those test results back. That speaks to, where was this person? Who did they come into contact with? And I think a lot of people have concerns with that. So that is one of the questions that I have with the Department of Health, is how can we get these tests processed faster? So more people are aware of the cases that are out there. But unfortunately, because of HIPAA requirements and state and federal laws, a lot of the information can't be provided to the general public. And really all that they're allowed to divulge is that this is within the county limits. They can't tell you a specific community. They can't tell you where this person was, that sort of thing, without violating federal privacy laws. So we all, again, have to do our best to understand, to be patient through this process. I know that I've been in contact with Indiana Regional Medical Center continuously. They're doing the best they can, following the right protocols. I would like to see the test results be returned faster, though. So we know, in more real time, that there are additional cases within the community.
Great, thanks. I guess I have one more question, and it's maybe you can give us a sense of what you're seeing this pandemic play through in Indiana County. Our numbers are pretty low, and we hope that we're doing enough social distancing around here so that they stay pretty low. there hasn't been a whole lot of communication out of IRMC. I guess my question is, do you feel like our healthcare system here in the county is prepared for a possible outbreak like we've seen in other places? Are there things that the community could be doing to help our healthcare system? There's a lot of mask making and things like this. Are you feeling confident that our healthcare system here in the county is up to the challenge that may be coming?
Well, first, we don't know what's going to happen. I think we are doing the right things. As Shireen said, we have some of the best people in the state working for Indiana County in our Human Services Department, in our Emergency Response Department. IRMC is in great hands, and they're doing everything they can. Unfortunately, we don't know where this is going to go. The cases continue to increase, dramatically every day across the Commonwealth. People need to stay home. If people don't follow the guidelines, it's going to continue to spread. Maintain that 6 foot distance. We have to do the right things. Wash your hands. Minimize the trips to the grocery store if you can. I think we have right now, Gerald, in place the adequate resources and the staffing and the personnel with the expertise to handle it. But again, we don't know what's going to happen. So that's why I think it's so important. We all do our part to minimize the spread. At the same time, though, we have to maintain, the future for our community as well.
Great. I really do. We're going to pass on. Do you have any other comments that you want to just let our audience know about the COVID-19 pandemic and what they can do?
Well, sure. I want people to know that they can rely on my office. You can call us at 724-465-0220. We are staffing, as I said, and you can go to the website, simply repstruzzi.com. You can email us. We have a plethora of information available on the website, and we continue to post real-time information on our Facebook page, which is, again, simply Facebook/repstruzzi. or facebook.com/repstruzzi. So we're doing everything we can to keep people informed, and we'll be there for you. I'll be, as I said, in Harrisburg again next week. We're going to be trying to move some additional bills to help our communities and to provide additional resources to all of our first line responders.
Great. Thank you so much.
Thank you.
Do you think we can have you on here again next week? Get an update?
Yeah,
Fantastic.
absolutely.
Great. Thank you so much, Representative Struzzi. Thank you for joining us.